What are the advantages of the tumescent liposuction technique and why I prefer this technique for the liposuction, especially for the liposuction of the arms and legs? In this video, you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. So let's talk tumescent liposuction. What is tumescent liposuction technique? Tumescent liposuction involves injection of the tumescent solution under the skin and the adipose tissue to facilitate the fat extraction. And tumescent solution contains several ingredients. Most important and most common of those are the vasoconstrictors, such as epinephrine, the medication that will shrink your vessels. Because of this medication, you can extract fat with minimal blood loss. The solution most frequently also contains local anesthetics, such as lidocaine, that numbs up the area and allows us to extract the fat with minimal pain and discomfort, and also facilitates pain control immediately after the procedure. So there are several advantages to the tumescent liposuction, and we already mentioned a couple of those. First one is a reduced blood loss versus conventional liposuction, where you don't inject the vasoconstrictors inside of the adipose tissue. Tumescent liposuction allows us to extract the fat with minimal blood loss. Plus, the advantage of local anesthesia is that you don't experience significant discomfort, and it allows us to perform the procedure with the patient being awake or minimally sedated, so it does not require general anesthesia. As a result, the recovery is usually much faster. People are able to walk frequently from the procedure to the recovery room, and it helps to streamline their recovery. Because of the use of local anesthetic in the tumescent solution, you frequently hear that the tumescent liposuction has actually lower infection rate. Nobody knows exactly how it works, but this infection after the tumescent liposuction is exceedingly rare. So in this video, I want to take you through the liposuction of the lower extremities on the patient with the lipedema. We had a significant heaviness in her legs. She did not like the look of her legs, and we were able to achieve great result in just one session of the awake tumescent liposuction. We have a beautiful patient today. She's young, healthy, but unfortunately she suffers with the symptoms of lipedema. So lipedema is a condition where you develop abnormal fat deposits, usually in your lower extremities. Sometimes I see it in the upper extremities as well. No matter how hard patient tries to lose weight, they still have that stubborn fat. The fat is more granular, and you can see in this patient right here, when I pinch it, you can see how granular her fat is. The patients frequently describe to me the feeling of a rice crisps, granules under the skin. Also, that fat is tender, so when I'm pinching her, she actually feels a little bit of a tenderness. And there are some people feel more than the others. It bruises easily, it's very stubborn, and when you take that fat out, you can see it's very granular and it's pale, so there's an abnormal vascularity. That fat is hormone sensitive, so the condition usually gets worse during teenage years, pregnancy, and during the menopause. The patients typically have this bracelet appearance, so she has total sparing of her feet. You can see this very skinny feet, but right here she has that ankle bracelet and then the abnormal fat deposit, and this typical appearance of the leg where you don't see the outline of her calves, even though she's pretty slender, that it's kind of cone-like appearance. There is no definition. So we're gonna work all around here, try to take that abnormal fat. This will improve her functional status. She will be able to move better. She will be able not to feel as much of a heaviness in her lower legs. But also, cosmetically, she will notice better definition of her lower legs. We're gonna get rid of those cankles right here. Also, she's bothered by this excessive fullness in her around her knee area, so we're gonna work on that to better define her knee. So when we work on this, look, this just makes your leg appear to be skinnier if you do that. So that extra fat deposit will bulge around the knee. We're also gonna address with the liposuction today. Patients typically bothered by this hooding over the knee. And this is, we gotta be careful so not to create divot here, because we gotta blend it with your anterior thigh. We're gonna do the procedure awake. The patient is awake. She got little medications to help her relax, but it's a awake procedure, no general anesthesia. She will be able to walk immediately afterwards. She will be sore, and usually the feet swell up for quite some time. Sometimes up to several months, but people are able to resume majority of the normal activities in a couple of days. You see it? You looking in the mirror? Good plan? I know it's a little blurry there probably.
I'm saying
So this stuff okay? Around the inner knee,
Yes.
okay? I'll work some in there, on the outside, and then all this. So we're gonna try to get rid of all that abnormal fat. So here you have your bone here, but right here, more lateral compartment here, we're gonna work on that. We're gonna work on the mostly in the back. That's where people have the most of the fat. The procedure starts with numbing up the patient. She's comfortable. She's laying there. She got a little medications to relax, but we also provide them with the laughing gas, so nitrous oxide or Pronox, which is a mixture of nitrous oxide with oxygen. So patients can self-regulate, and if it gets pinchy, they can get a little analgesia from inhaling that gas. It also has anxiolytic effect, so it helps them to relax quite a bit. The patient is very calm. And what I'm doing first, I'm infiltrating that local anesthetic called Tumescent solution. So we're using this hollow, blunt little cannula, and sometimes I sprinkle people in the operating room. The cannula goes under the skin into that subcutaneous fat, and we infiltrate the solution using the special pump, Klein pump, named after Dr. Klein, who first described this technique of the Tumescent liposuction. So the solution contains lidocaine to numb the patient up, epinephrine or adrenaline to shrink the vessels to minimize any blood loss during the procedure, and I also add tranexamic acid to my solution, which is a hemostatic agent, helps to minimize the amount of bruising or any potential for bleeding, even though it's highly unlikely, but mostly helps with the bruising and the amount of leakage after the procedure. And the good news about having patient awake, that she can move her feet sometimes for me, because you can see it's a kind of challenging area to work on. But having her awake helps me to get in every spot. If someone jumps from our 33 gauge, oh, look at this. This is cool. So I'm infiltrating the area with the anesthesia, and look, from the pressure, from the interstitial pressure, this little globular fat came out. And this is definitely abnormal fat. Look at that. It's pale. It has a little vascularity on the periphery, but right in there it's pale, it's granular, and kind of popped out from that pressure under the skin. That little fat globule popped out. And this is what lipedema, abnormal lipedema fat looks like, with the very hormone sensitive, and looks like a rice crisp, like a little granule. And that's what we're gonna extract. And when we extract the fat, you'll be able to see how much I put in. Just sometimes my assistant will remember, so we just keep track of things. So 700 ml of the Tumescent solution, this interior compartment. Now we're gonna work around the knee. So before I make a poke in the skin, we use this local anesthetic, tiny little needle, the same needle actually we use for facial injections for Botox and stuff like that. It's tiny. It's actually called invisible needle. 33 gauge. And when I make the insertion point, we use the special round tool, which is 2 millimeters wide, a little punch. And that creates a round little hole. And when it heals up like a little dot, a little freckle, so it leaves no linear scar or anything like that. Just a little dot. And the next step is again infiltration of the local anesthetic, just in a different area, because we gotta numb everything up. We are done with the infiltration. Patient's leg, lower legs feeling tight and heavy. And yes, I will show you the fat cells. Well, we'll put them in the bucket and you'll be able to. Not yet, we haven't done it yet. So we're gonna start extracting now, and I'll be able to show you what we get now. But again, look at this abnormal granular fat, because I increased the pressure under the skin, and that fat wants to come out. Granular, pale, typical lipedema fat. And the patient said one interesting thing. So once we're done infiltrating, she said her legs feel the same as they feel at the end of the day. So at the end of the day, she feels a lot of heaviness in her legs. We pumped about 2 liters of Tumescent solution in each leg, and that's how her legs feel at the end of the day. So she did great with the injection. So we're using this flared Mercedes cannula, and curved cannula helps me to work around the ankle sometimes, so I like that a little bit better. And this is the actual fat extraction. So the cannula is attached to a suction machine, and she's able to see real time as her legs are getting skinnier. result. So we suction not just in front, but also in the back. Definitely significant reduction in the circumference of the legs. We highlighted her ankles. Everybody likes that. She will look great in the heels. And you can see once she stands up on her tippy toes, you'll be able to see her muscles. And this patient is very fit. She was always embarrassed about her calf muscles not being visible. So this time she'll be able to see them great. So we worked around the knee as well. So now she has nice taper toward her lower legs. They look natural. They look great. So the skin, most of the time, especially for younger patients, below the knee, it's never a problem. So it's gonna shrink, it's gonna retract pretty well. I'm gonna pinch you here, pinch you there, and you can see there's just the skin. That's kind of normal, beautiful, youthful leg should look like. So I think she's gonna be very happy with the result there. The patient is all done, so I think it's gonna be a great difference for her. We put her in the compression garment. She will keep that on for about 48 hours. In 48 hours, she can shower, take everything off, and put the garment back on. I hope you find this video helpful. Click the like button and subscribe below. Thank you.